This is Andrew Kramer, Urology Associates, Cape Cod, High Volume Penile Implant Practice. 15 just in the last week and a half. This gentleman comes in, and I need a title for everyone. And in this case, I just remembered it by one thing. It was just picture perfect anatomy. And that's due to him, not me. I mean, he gave me good anatomy. He's healthy, he's got healthy, strong tissues, good nutrition. Anyway, look at the tunica, pearly white, right down to it. That was on the left, now the right. Little septum in between, holding the urethra in place. But look at that. Urethra in the middle, corpus cavernosum on either side. You see them sort of going down and decussating onto the pelvis, so they spread a little to give support to the penis. But you can just take a finger and sweep the urethra like that, left and right, and see the erectile bodies on either side. So that's when you have this 1 in 100 situations where you just have that beautiful anatomy to show. So he is going to do great because you're only as good as your exposure to the corpora. In this case, we've got excellent exposure. So we're just going to take them, open them one by one, measure dilate. Hopefully, there's no corporal fibrosis, and then put in the cylinders. Again, he really is giving us healthy tissue and good, clear anatomy. I guess if you're a student, you're a resident, you're training, this is what you'd want to be your first case. Just everything lines up perfectly. Again, it's an early surgeon. You might think you're doing a great job, but the patient's giving you good anatomy, so that helps. So going to the left here, we're measuring and we're dilating. Again, I'm going to open the corpora under complete visualization and control, and then use our blue dilator and measurer to get a size. So I'm going to show you what we have. We usually put the blue towel right up to the corporotomy, and then when you open up the implant, it comes right out of the bag, hasn't touched any skin, new gloves, you put it into the cylinder in the corpora, and you can see then you didn't have to touch anything. Didn't even touch the skin of the penis or scrotum. So cylinder 1, cylinder 2, as you can see, he's got a 24 centimeter with no rear tip extenders. That's just a perfect, if you're going to be a size, you want to be exactly the size of one of the implants that the factory comes in. That way, you don't need the foreign body, the rear tips. You don't have to do any splicing. So he comes in at 24. So that's great. The pump, we're going to splice together to the reservoir. So you have triple splice. I must have cut off some extra tubing, but when I pump him up, going to like the result. He's going to like the result most importantly, but taking my finger, what I'm doing is I'm sort of molding and bottling. So as you pump it up, it fills out. There might be some little crooked edges and grooves, and when you take your hands and smooth it, so I'm smoothing the corpora as it inflates, so the cylinder becomes completely rounded and cylindrical rather than buckling, and I'm just guiding it. It would get there on its own, but I guide it with my hand, smush those little bumps and ridges, and then you get the perfect result right here. Cylinders up, mid-glands. I'm happy with the result. Going to close and dissolve those stitches in the scrotal skin, and I think he's going to be pain-free, ready to cycle the implant, hopefully as soon as maybe a week or 10 days from now. That's record time. Andrew Kramer, Urology Associates, Cape Cod. Thank you.